Hi, good afternoon, Mr. Ali. So, I believe that this will be our very first counselling session for your TB treatment.
Yes.
Okay, before I begin, let me introduce myself. I'm Miss K. Before I begin, can I ask you, would you like to share anything regarding your past medication history?
Good afternoon, Miss K.
Okay.
Well, there is something in terms of my medication before this. I have problem in terms of discipline, when to take it or what to take it, which medicine. Sometimes they have soft gel, pill, and what's the rod thing they call it?
The capsule.
Oh, the capsule. Yeah.
Oh, I see. Okay. Well, thanks for sharing that with me. I personally feel that it is quite common with many people having those problems.
Oh.
However, I would say that it's not a good practice, as medication compliance is necessary to improve your condition. So for now, I will ask you not to worry about that, as I will discuss further in detail about how you can overcome that problem.
Wait. Does it mean if I got this TB, I can't meet people in public anymore?
Well, of course you can go out in public. So let me explain. There are actually two types of TB germs. The one that you are having now is in the dormant, or it can be said in other words that it's in the sleeping state.
Oh, I see.
Okay, the other one is the active state. So there will be no problem for you to go around in public and chit-chat with people. But I would advise that for the first 2 weeks of your treatment, for you to stay indoors and wear a face mask whenever possible.
Oh, thank God. So what's the medication that I'll be taking after this?
Yes, coming to that. So you will be taking 4 drugs during this initial phase regimen, which will last for 2 months. Okay, so the 4 medicines that you will be taking are ethambutol, isoniazid, rifampin, and also pyrazinamide. Got it?
Yeah.
Okay, so you will be taking a daily dose throughout, which are 56 doses for 8 weeks, which is 2 months.
Okay.
Okay, so I will discontinue the ethambutol once your results for the drug susceptibility shows that the isolate is susceptible to isoniazid and also rifampin.
Oh, I see. Wait. Just now you mentioned about dose. What is dose? What does it mean?
Oh, okay. So let me explain to you. 1 dose indicates all the 4 medicines that you will have to take in 1 day. So meaning that 1 day, 1 dose, 7 days, 7 doses.
Oh, I see.
Okay. So based on your body weight, I have calculated the daily dose that you have to take. So the doses for ethambutol will be 1120 mg daily. For isoniazid is 350 mg daily, whereas rifampin is 700 mg daily, and pyrazinamide will be 1400 mg daily.
Wow, 1,400 gram. Why so many one?
Oh no, it's not 1400 grams. It's only 1.4 gram, which is equivalent to 1400 milligram, and it's daily.
Oh, okay, I see. Oh, alright. So how do I take this medication?
Oh, okay. So you will be required to come to the hospital every day to take your medication.
I see.
Okay, so you will be taking the medication in front of me or other trained nurses. So if there's any problem during the regimen, you may ask us directly. Okay, and as you mentioned earlier that you have some compliance issue,
Yes.
so that will be taken care of since you will have to take it in front of us here every day.
Oh, I see. Since I'll be taking it every day, is there any side effect like vomiting or nausea?
Yes, there will be side effects, but the common ones are actually decrease in visual acuity and red-green color blindness. Okay, other than that, there will be gastric upset. You might also get nauseous and vomit at times. And apart from that, there will be some drug fever and also skin rashes. Okay, there might also be some red-orange color to your urine, your sweat, or sometimes your tears once you have begun taking your medication. This is completely harmless and you need not worry about it.
Orange tears and sweat? My god, good thing you told me about this earlier.
Oh, okay, you do not need to worry about that. Okay, as there are ways to manage the side effects for the drugs. Okay, for example, for the nausea and vomiting, we can change the time for you to take the drugs so that it will be as close as possible to your meal time.
Oh, I see.
So you may bring your meal along for the next session and you can have it just before you take your medication.
Oh, alright.
Okay, and before I forget, do you usually drive?
Yeah, I do. In fact, I drove here by myself. Why is it?
Oh, I see. Well, I will advise you not to drive for the first few sessions after taking the medication, as one of the drugs, rifampin, may make you drowsy. So I would advise you it's better to bring your relatives or friends to fetch you after your sessions.
Oh, okay, sure. I will not take the risk either.
Okay, as for the skin rashes, I will prescribe you some antihistamines to stop the itchiness. You may feel feverish for these 2 months during this therapy session.
Okay.
Okay, and please let me know immediately if you feel nauseous or you vomit or you feel fatigue after taking the medications.
Oh, okay then. Apart from that, what else can I do to improve my recovery? Well, apart from the medication.
Apart from medications, you should eat a balanced diet and exercise often. Well, it all depends on how you take it. So try to lead a happy life and go on without worrying much. Just make sure not to miss out any sessions and do get adequate rest.
So, it's a balanced diet, enough exercise, enough rest, and plus the medication.
Yes, that's right. So, do you have anything to ask?
No.
Is everything clear about your session and the doses?
Yes.
Okay, so now these are your medicines and there's some water over there, so you can take it now.
Thank you.
Oh, okay. Do you mind opening your mouth so that I can check? Okay, so that's done then.
Okay.
I'll see you tomorrow.
Alright.
Have a nice day. And please remember not to drive. Yeah?
Okay, thank you.
Good morning. Good morning. Oh, Miss Fatima. Please come in. Hi, Miss Fatima. How are you feeling today? I hope you are feeling well.
I'm fine, thank you. Miss Dia, I was told to receive a follow-up treatment even after I have received my initial phase therapy.
Yes, you are right. You are not actually receiving your maintenance phase regimen after you receiving initial phase regimen.
Oh, I see. So does it mean that I still have to take 4 types of medicine as in initial phase regimen?
Oh no. For this maintenance phase regimen, you only need to take 2 types of drugs. As you notice, in your initial phase regimen, you take 4 types of drugs. That are isoniazid, pyrazinamide, rifampin, and ethambutol. But now it's only 2 types of drugs, which are rifampin and isoniazid, as prescribed from your doctor.
Okay.
Okay, so Miss Fatima, tell me, what did your doctor tell you this medication was for?
He said that these medications are important to kill all TB germs in the body.
Yes, that's right. Even if you start to feel better, you will have to stay in your medicine track in order for your body to be cured.
Okay. So what should I expect from this medication?
Okay, for isoniazid, you will also experience nausea and vomiting, tiredness, and loss of appetite. For rifampicin, it will also cause the same side effects, but it also causes red or orange discoloration of your body fluids, including your urine.
Oh, really?
Don't worry, Miss Fatima, as it will be back to normal as you completed this regimen. You will receive this treatment for another 4 months. Okay, so tell me, How did your doctor tell you to take this medication?
He told me to take them twice a week.
Okay, let me see. For rifampicin, the doses for rifampicin is 10 to 15 milligram a dose, and you take that twice a week. For arsenazate, it is from 15 to 20 milligram a dose.
So, will I be 100% healthy after this?
As long as you completed this regimen and follow the instructions diligently, you will not have to worry. If you have any curiosity, be free to ask me, okay?
Okay, and thank you so much, Miss Dia.
Thank you.